From physiology to crisis, managing labor stages and emergencies. Welcome back to Easy Medics Daily. What goes through your mind when a mother says, "I think it's time," ? How do you know if it's for real? Or what if, during a seemingly normal delivery, the fetal heart rate suddenly plummets? Or a patient starts bleeding excessively right after birth? Understanding the roadmap of normal labor is what lets you instantly recognize and react when the journey goes off course. Today, we're going from physiology to crisis management. First, the roadmap. You need to know the stages of labor to spot the warning signs. Step 1. Distinguishing true labor from false labor. True labor has regular, painful contractions that get stronger and closer together. They won't stop with hydration or rest. Key indicators or the show. That's the bloody mucus discharge, the water breaking, and progressive cervical change. Now, let's walk through the stages. Stage 1 is the marathon of dilation. It has 3 parts. The latent phase is from 0 to 3 centimeters. It can last for hours. Your focus here is on comfort, hydration, and ambulation. Then comes the active phase, from 4 to 7 centimeters. Contractions intensify. Your focus shifts to close monitoring of vital signs and fetal heart rate, and providing pain management options. Finally, the transition phase, from 8 to 10 centimeters. This is short but intense. Mothers may feel overwhelmed, nauseous, and have an overwhelming urge to push. Your role is to guide their breathing and provide constant emotional support. Stage 2 is the power of pushing. From full dilation to the birth of the baby, you're guiding effective pushing and monitoring for crowning. Stage 3 is the final step. Delivery of the placenta. Active management with oxytocin is key here to prevent postpartum hemorrhage. Knowing this normal path is what makes you snap to attention when things go wrong. Let's talk about 2 critical emergencies. First, fetal distress. This requires an immediate, drilled response. The signs: late decelerations on the monitor, severe variable decelerations, prolonged bradycardia, that's a heart rate below 110, or meconium-stained fluid. Your nursing protocol is 6 steps. 1. Immediately reposition the mother to her left side. 2. Administer oxygen at 10 liters per minute via a face mask. 3. Give an IV fluid bolus. 4. Discontinue oxytocin if it's running. 5. Notify the obstetrician and anesthesia immediately. And 6. Prepare for an emergency delivery. The second major emergency: postpartum hemorrhage, or PPH. It's the leading cause of maternal mortality worldwide. Use the simple 4 T's mnemonic to run through the causes quickly. Tone. Uterine atony, the most common cause. Trauma. Cervical or vaginal lacerations. Tissue. Retained placental fragments. And thrombin, a coagulation disorder. Your nursing action is critical. Massage the uterine fundus. Monitor vital signs every 5 to 15 minutes. Measure blood loss quantitatively. Don't just estimate. And prepare for a massive transfusion protocol, all while providing calm, emotional support to the frightened mother. The bottom line: your expertise in the normal physiology of labor is your anchor. It lets you use tools like the partograph to spot trouble early and spring into a well-rehearsed emergency protocol, turning a potential tragedy into a managed outcome. If this guide to labor stages and emergencies was helpful, imagine getting this kind of clear breakdown regularly. Subscribe to Easy Medics Daily and hit the bell for your daily dose of clinical clarity. Your future self will thank you. Until next time, keep learning,